Good afternoon, everyone. Welcome to this afternoon's press conference, which is the last press conference before Christmas. The next one will be on January the 8th, I believe, but we'll obviously give you more details about that as and when. We're not live today, we're recording, but it will be uploaded as soon as possible for the record. So today we're joined by, on the panel by Lucy Whiteman, our Director of Public Health, and we've got Deborah Needham, the Chief Executive Officer for Northampton General. And then we've got Joe Watt, the chair of the CCG and Primary Care Trust. And we've got Superintendent Elliot Foskett from Northamptonshire Police. We also have a number of councillors on the call as well, who will no doubt be coming in on some of the questions. So thank you very much for attending today. The running order will be, we will start with Lucy, as we usually do. Then we'll go to Deborah Needham, then we will go to Joe Watt, and then we'll come to Elliot Foskett, and then we'll open up to the questions which kindly have been submitted in advance. So we'll go quickly to Lucy Whiteman, our Director of Public Health, who's no doubt had a very interesting week, as always with these things. It's never a dull moment in the public health arena at the moment. Over to you, Lucy.
Thank you, Councillor Morris, and good afternoon, everybody. Thank you for joining us again. We're going to share with you the latest surveillance report that obviously will be on the County Council website. So this contains data up to the 13th of December, as people can see, and the key messages coming out in that last week. Clearly, we still have a challenge locally. We've seen an increase in cases. We've now gone back above the 1,000 mark, 1,243 cases in that week. We do, though, still remain in tier 2, and it is really by the skin of our teeth. So we do need to be really, really vigilant over the coming weeks, and particularly start to consider really what we should be doing over Christmas with regards to mixing. The majority of transmission continues to be between and within households, and that really, I can't drive that message home enough, because clearly if we're going to be mixing households over Christmas, we are going to see significant ramifications with that regard in the new year. And coronavirus related hospital admissions and deaths still do remain high in the over 60s. There has been some reduction in different boroughs and districts, but the overall challenge and the overall risk still is significant for that age group. So if we go down to the first page of data, please, Alicia. So if we go down to slide 6. So again, this just provides the context for the last week's data. So 7th to the 13th of December, 1,243 cases. So you can see, despite a slight drop out the back of the lockdown period, we're now very much firmly back on an upward trajectory, which obviously is a concern, particularly as we head into Christmas. If we go to the next slide. So this just gives the crude number of cases in each borough and district. The red arrows speak for themselves. It's an increase overall in the county compared to last week, and it's an increase in every single borough and district. We're back up over 500 cases in Northampton alone, and we've got lots and lots of our areas in triple figures again. So absolutely not the position we want to be in going into a period of relaxation. If we go on to the next slide, it just gives us those patterns over time. Again, you can see the very slight effect that we had from the lockdown, which, as we've talked about, we didn't maximise because of the behaviours we saw, people mixing after the announcement. And, the real concern is we're back on an upward trajectory already, and we saw what happened when people mixed before the lockdown. We really cannot afford for that impact to hit Northamptonshire again. If we go on to the next slide. This just gives a breakdown from a point of view of gender and age. You can see now we're really struggling with that 40 to 49-year-old age group. That was our biggest number of cases across both genders in that week up to the 13th of December. So we see that transmission. We know this is a working age population. We know that they've got caring responsibilities, but we're just imploring people to obviously work from home wherever they can, and really to consider whether they should be mixing over the Christmas period. Indeed, you can still see that rather large increase in the over 60s, particularly in the over 80s, are most vulnerable in the population, and that is translating into hospital admissions, as people know, and sadly still deaths as well. The next slide gives a breakdown with regard to the over 60s. So you can see there is variation across the piece. Clearly there are still challenges in some of our boroughs and districts, and you can see that Northampton and East Northampton still are above the county average with regard to the over 60s rate as a weekly rolling average. But you can also see they have started to have downward trends, which is positive signs. And again, we have got a couple of areas as well. Corby, you can see, has remained relatively static, but a slight downward trend, and again Daventry a slight downward trend. So we have seen some positive areas where we're seeing improvements, but overall we're still seeing too many vulnerable people hospitalised, and our system is creaking with regard to the overall demand on top of normal winter demand. If we go down to the next slide, that just breaks down the case rate for boroughs and districts. So you can see Northampton, they're still significantly higher than both the county rate and the England rate. So it's still a real concern. And you can see that county rate there is 211.5 cases per 100,000, and it's increased again since then. So, you know, we are very much talking about tier 3 criteria here. So we've got a challenge, and I'm sure people can rise to it over Christmas to make sure that they actually do restrict their movement so that we don't see any of our areas start to move up tiers in the new year. The next slide just really starts to drill home the impact of COVID on our older and more vulnerable population. At this point in time, there were 247 COVID positive patients in our hospitals. Now, clearly things have moved on a little bit since then, and Deborah's on the line and will give us a slight update on that. But, you know, it is still sustained pressure, even though we've started to see, as I said, some positive glimmers of light around our older population infection rates. The next slide just gives us an update from a point of view of schools, and obviously Paul's on the line again if there are any further questions, but they're maintaining a really positive position. We've got 100% of schools open, but yes, we are seeing the impact of increased case rates in the population, and therefore we've only got 86% of our pupils attending education at the moment. Obviously, although all of our efforts are going into ensuring there's some online provision for those that are not able to attend in person. But you can see from the bottom, there's been an overall downward trend in recent weeks in the number of cases in both children and teachers. That is starting to tip slightly back up again as we're seeing case rates in our younger population start to pick up a little as well. So again, you know, more and more evidence the fact that we need to be careful over Christmas. We don't want to be affecting our children's education even more than it has been as we go into the new calendar year. So the next 3 slides, obviously people can look at, it just provides an update from a point of view of the most common areas from a point of view of accrued rates and accrued cases and rates. And people can see the outbreak picture. So we've had a slight increase from last week on the number of outbreaks that we're managing. And indeed, that's affected some of our case rates. People will obviously see from the graph there that we've got a mixture of different settings and locations where outbreaks currently are, but we have had a few in care home and care services, and also again we continue to battle slightly with the hospital and hospice settings. But again, please do remember those are settings that have proactive swabbing, so we will find outbreaks in asymptomatic patients and residents where we wouldn't usually find those in other settings because we haven't got that same rigorous testing regime in place. If we just go down to the next slide. I'll just finish on this one if it's okay. So this is good news from a point of view of winter flu. Obviously, this is one of our tools in the toolkit to help manage the overall pressure in the system and just keep our residents safe. So again, this is the standard reporting for those that are eligible. We still haven't received any information about the extended eligibility categories, but of those that typically and traditionally get a flu vaccination, you can see that we've got an increased uptake in the over 65s compared to the previous year, as well as the at-risk groups, which are aged between 6 months and 65 years. And we've still got a really good uptake and improved uptake on last year in the 2 to 3 year olds. The bit I'm really pleased with is we have got that little marginal increase now as well that we were hoping for in vaccinations in our pregnant population as well. So key to make sure that that group that aren't going to be eligible for vaccination for COVID do certainly get their protection from flu, and obviously that helps protect the newborn as well when it does arrive. So good news on the flu front, still pushing for people to go and obviously take up their flu vaccination as and when they get offered it, contact their practice or their local pharmacy if they're usually eligible and haven't been contacted, and then obviously wait if they are eligible for notification of the COVID vaccine, and that will be rolled out over a number of months, so please do be patient. But I'll stop there, Councillor Morris, if that's okay.
Thank you very much, Lucy. Some worrying figures there, if truth be told. In summary, we're living on a knife edge, really, in terms of being placed into Tier 3 in the new year. And I think, as you've said, unless we get the numbers dramatically down, we're going to have an issue in January, and so we mustn't be complacent. But I'm going to, and obviously the hospital numbers were of interest as well. So I'll bring in Deborah Needham now, Chief Executive Officer for Northampton General, because she can update us on those figures. And thank you, Deborah, as always, for joining us. I know how busy you all are, so we really do appreciate it. Deborah.
Thanks, Councillor. So although we've heard earlier that Northamptonshire has remained in Tier 2 this week, restrictions, as we know, are likely to be eased further over Christmas. So my first message really is to urge you all to reduce contact with other people as much as possible and continue to follow the rules that have been set for us. Just in terms of what those rules are, make sure that you wash your hands frequently, wear your mask, maintain social distancing, and please do stick to the rules. Remember that just because you can doesn't mean that you should. Reducing contact with other people as much as possible, especially now and over the Christmas period and into January, because this is going to keep us all safe. It will help us to reduce the number of infections, and therefore that then means that we will reduce the number of people who become so unwell that they do need our care in our hospitals. Now, like many other areas across the country, we are experiencing quite high demand, and that's for both our COVID patients and our non-COVID patients. Both acute hospitals in the county are operating with most of our beds full at the moment. And as of today, we have 254 COVID positive patients across both Northampton General and Kettering General. We do have enough ITU beds, critical care capacity, and they're obviously used for our most seriously unwell patients. But along with COVID, we just need to remember that we're also dealing with the normal winter pressure at this time of year. So we've got higher numbers of patients who are really quite poorly at the moment in our beds. As I've said previously, we have had to reduce some of our non-urgent activity to focus on patients with urgent and immediately life-threatening conditions. So if you've had an appointment, an outpatient appointment, or an appointment to come in for an operation, if it's needed to be rearranged, we will call you directly. Please don't call us. If you don't hear from us, please come as normal for your outpatient or for your operation. So we're going to hear shortly a little bit about the COVID vaccine. It's obviously arrived with us, but it's going to be quite some time before large numbers of the population are protected from the virus. So it's really important that we all remain vigilant at the moment. And what that does is, as I said, it helps us to just focus on our most seriously ill patients. So that means I'm asking the public to stay well, keep up to date with your medication and prescriptions, and use your GP and pharmacist, and phone 111 if you are worried at all. Make sure that you seek help early rather than waiting until you really do need it. I think coming into the Christmas period, it's also really important that you just check your GP and pharmacy opening times. Make sure that you've got enough medication, for example, to see you through the holiday period. So as I said, NHS 111 will signpost patients to the most appropriate place. And that might be that you are given a time slot for attendance at one of our A&E departments. But just really to remind people that A&E is for urgent and immediately life-threatening cases only. So please do use NHS 111. My other ask today of the public is if you've got a relative or a loved one who is in hospital and they are ready to go home, they're medically fit to go home, then please help us by getting them home as soon as possible. If they are waiting for a little bit of care in their own home, is that something that you could maybe provide until we can get social care to provide that in their home? So we're really asking for help with that going into the Christmas period. So I'll stop there, and final thing from me is just to say have a very happy and safe Christmas. Thank you.
Very much, Deborah, as always, and for your attendance. I think the key message is it would be a tragedy for anyone to get COVID now, between now and the vaccination rollout, particularly if they became seriously ill and possibly lost their lives. It would be an absolute tragedy, wouldn't it? So, but you did mention the vaccine there, so I'm going to come to Dr. Jo Watt now, the chair of the CCG and Primary Care Trust. Jo.
Thank you, Councillor Morris. So really just wanted to give people a little bit of an update from a vaccination point of view. This is not yet over, but this is the beginning of us fighting this virus and getting back to some sort of normality. And as Deborah said, this is going to take a number of months, but we are so excited and so pleased to see thousands of vaccines having been delivered across our county. We're covering all the corners. We are making sure that everybody who is in the over 80s and who is care home workers in particular are covered, and we're making sure that we get that to everybody. As we've said before, we have not yet managed to vaccinate everybody. This is going to take a number of months, and we would urge people not to contact their GP surgery. As long as you are registered with a GP, you will be called at the correct time. So people are going to be gradually called in. There will be more and more deliveries. More people will be vaccinated. We've had some fantastic feedback from people who've had their vaccines, but please can you remember that it is at least 7 days after your second vaccination before you get protection. So even having had one vaccination, you still need to observe hands, face, space. This is not over yet. You still need to be really careful. And I think to build on the comments that were made before, it's not just about people who are admitted to hospital. That is absolutely top priority, preserving and keeping that capacity, but it's also about long COVID, and we're certainly seeing more and more cases of long COVID. So even for those people who are not admitted, it is really, really important that you avoid picking up COVID. You keep your social activities to an absolute bare minimum, even if the rules say you can do a little bit more. But vaccination is really exciting. Building on what Lucy has said, we've been able to protect people against flu for a number of years. We've now got another virus that we can protect people against, but it is going to take time. And another thing I really just want to say is thank you so much to everybody who has been involved in the vaccination. This is the biggest campaign we have ever seen as a country and as a county. Thank you to the GPs, practice nurses, pharmacists, paramedics, volunteers who have been amazing at managing the queues. Every single person, I'm probably going to forget somebody, but everyone who has been involved in vaccination, this has been a massive effort. It will be massive for the months to come. And just thank you to everybody who has worked so hard to make this a reality. But bear with us. Don't nag your GP surgery. You will be called, and we will call people in the order according to the lists on the NHS website. So please wait to be called.
Thank you very much, Jo. Some positive views on the vaccination, but still some caution as always with all these things. Talking of cautions, I will bring in Superintendent Elliot Foskett now from Northamptonshire Police to give us an update on enforcement, etc., throughout the county. Elliot, good afternoon.
Good afternoon, Councillor Morris, and good afternoon, everybody. And it falls to me to be the Christmas Grinch of the piece today with their enforcement updates after that list of thank yous and warmth. So I'm just going to give you a brief update on the level of enforcement activity, really. Over the past week, most of you will have already heard we've issued 4 £10,000 fines, one to the organiser of a party, one where there was a DJ at the party as well. Another to an organising party for a wedding reception which took place where there was around 75 people. And then following a further investigation, another £10,000 fine has been handed out to the organiser of yet another party. Now, I mean, from a police point of view, and I'm sure I speak on behalf of public health and my colleagues here on the call as well, it's really disappointing to see that people decide to host huge events like this last weekend, and in one case involving more than 100 people. I know that was widely reported in the news. We've been responding to COVID-19 now for about 9 months. People know that they can't have parties. You know you can't have large gatherings, so ignorance isn't an excuse when the police arrive and break it up. And we've issued around 45 fixed penalty notices as well in the past week for a variety of reasons. The usual reasons around face masks on public transport, face masks in shops, etc., where the people don't have an exemption. And again, there's a bit of a selfishness to that, because people going out and about in public without wearing a face mask when they can, you know the risks, you know that the chances are you could pass on that infection if you have it. So one of the questions we were asked last week, which has come up again, was whether or not we've seen a rise in people coming into the county from outside, from tier 3 areas into us as a tier 2 area. And, you know, especially now, more so now that we're kind of almost an island surrounded by tier 3, is that happening? Well, you know, I'd like to say no. What I will say is that it has happened at the parties we've seen. We've seen people coming from some areas to visit friends and have these larger house parties, etc. And we've dealt with it accordingly. And even where people have left those parties without tickets, we have now got proactive investigations retrospectively looking to issue tickets, and we've done some of that this week. And I know that we're waiting to issue 13 more at the moment for people at those parties too. That aside, what we're not seeing, and what we're definitely not seeing at the moment, is a rise in people coming into the county from tier 3 to our businesses, to our pubs, for example. People aren't coming here just for a meal and a drink. We're not seeing that. And if they are coming here, then they are behaving, they're not breaching. Our hospitality sector on the whole have been extremely responsible locally. We've had 1 or 2 exceptions, but most business owners are taking this really seriously, which is great. I've been asked to comment about the police approach over the Christmas period recently. And again, I'm happy to discuss our approach as I have done before. You'll know that up to 3 linked households can mix over the Christmas period. But as you've just heard, just because you can doesn't mean that you should. And therefore, think about whether or not that's something you want to do. You've seen the figures, really, just act accordingly. We are going to continue to enforce over the Christmas period. I'm sure there's not many people out there who would want to pay £10,000 to host a party. If you decide that you're going to have a party, you can expect us to come knocking on your door, and we will issue a £10,000 fine. And even if you are not the organizer of that party and you are there, you are likely to get a £200 fine for being there as well. We've got dedicated resources on throughout the entire Christmas periods, specifically to deal with COVID. And we'll continue to work with partners in joint patrols with the environmental health officers, who continue to do a brilliant job as well, working with us on business breaches. So again, as I said last week, folks, don't think we're going to turn a blind eye over the Christmas period, because we're not. It's too important an issue for us as a county, and too important an issue for us as a country, for the police not to be enforcing. And to give you some indication, I will be staying at home with my wife, with my 2 children, with my dog, and a small turkey. And that's my Christmas for you. Thank you.
Thank you very much, Elliot. It's heartening to hear all the great work that you're doing as the police, but always a bit disappointing when you hear about these big parties. But as you say, the consequences are financially quite grave for them if they do that. And we know the majority of the population don't do those sort of things. They do obey the guidance and the rules. It's just 1 or 2 slightly misguided people, shall we say, put it that way, that disobey the rules. And thank you very much for all your work that you've been doing, and all your officers are doing to keep us safe over this period. It really is appreciated. So we're going to come now to the questions which have been submitted in advance. So we've got Laura Coffey up first. Laura, good afternoon, Laura. How are you?
Afternoon, Councillor Morris. Yeah, very well, thank you. How are you?
Good, thank you very much. For a Friday, not too bad.
Great. So if I can just ask Deborah Needham a question. I wondered, Deborah, how close are you to calling a major incident? And then, Elliot, you've already answered my question that I submitted, so thank you for that. And to any of the councillors on the call, I just wondered what you'll be doing for Christmas.
Thank you very much, Laura. We'll come to Deborah first.
Yeah, thank you, and thanks, Laura. So we have been, over the last 10 days, on the highest level of escalation at Northampton General. Kettering have been on the highest level, which is called Opal 4, for a couple of days. Neither of us have escalated to a major incident, but it's been severe pressure. Now, I think it's probably fair to say that over the last 48 hours, the numbers of our COVID patients have started to decrease very, very slightly, but not significantly yet. Certainly not enough to say, you know, we've turned the corner. So it's still very pressured. I'm expecting it to continue to be pressured over Christmas as well.
Thank you very much, Deborah. I'll come to Martin and Tom in a minute about Christmas plans. My Christmas plans are very small. They're basically me and the dog at home, which is as it should be really at the moment. So I will be enjoying lots of television and no doubt a massive box of Quality Street to myself, and no one will know about it. So it's even better. If they can't see you eat it, it doesn't count. That's what I always say. Anyway, Martin Griffiths, I'm going to come to you on that, and then I'll come to Tom.
Well, a quiet Christmas with my nearest and dearest, with some rest and recuperation in these very hectic and busy times. Probably a few films, and maybe even watch the Saints win. I don't know, could be, you know.
Thank you, Martin. Tom, over to you.
Yeah, very much the same. A very quiet Christmas at home with my immediate family, smaller than normal. We would normally have a bigger get-together, particularly on Boxing Day, but that won't be happening this year. So I'll be doing the same as Ian and Martin have outlined, plonked in front of a telly or reading a book with a drink and relaxing, because as Martin again has said, it's been a very difficult year. It's been a very busy year for us as councillors as well, with everything else that's been going on aside from the COVID pandemic, with all of the work that we've been doing around local government reorganisations. So I think just the ability to put our feet up for a couple of days is going to be extremely welcome.
Thank you, Tom. And further to that, I would say that I've personally made the decision not to go shopping other than for food. So all my any presents or anything like that have to myself and my dog have been delivered already. So I've made a decision to minimise much contact with anyone really in the build up to Christmas, because I feel that's the sensible thing to do. We'll have next Christmas where we can all hopefully go completely doolally and pull out all the stops for a traditional Christmas that we all know and love. I'm going to come now to Tom Hitchener from Northants Live. Tom.
Yeah, hello, can you hear me? Is that okay?
Yeah, we're good. Thank you, Tom. Thank you for coming.
No, thank you. Thanks for having us. I think Councillor Martin Griffiths is hoping a lot for Northampton Saints win, to be honest, at the moment, but we can all hope for a Christmas gift. Yeah, I suppose our question was really about the spike in infection rates in Kingsley Park and Racecourse and Ringstead and Woodford and Stanwick areas, if that makes sense. Those are two separate areas that have seen an increase. We've been looking into this, but could you possibly enlighten us about these isolated outbreaks, and if so, what settings they may be in, or why they may have increased, if that makes sense? But okay, that's great. Thank you.
Thank you, Tom, and I'll come to Lucy on that, though she may not be able to be super specific on the numbers and things like that, because we can't share a lot of that. But Lucy, over to you to answer that. Good question. Thank you, Tom.
Yeah, so thanks, Tom. I'm happy to let you know that they're care-related setting outbreaks. So it is because of the proactive swabbing, and quite often we find a number of cases at any one time in that kind of setting because of the close proximity, etc., etc. So it is care settings that are driving up those numbers in all of those areas, in actual fact. So obviously I won't be able to give you the names of each of those settings, but we're obviously able to contain that and work with the providers to make sure that we mitigate the risk, isolate, and make sure that additional staffing is put on, etc., so that staff can isolate as well. And it's one of the reasons that we've been able to obviously get back on top of some of the challenges with our older population, where we saw a lot of them hospitalised in the first wave. And that proactive swabbing continues, and we'll continue to identify settings where we have outbreaks, and it's helpful, but obviously it does drive numbers up.
Thank you. Thank you for your question, Tom, and thanks for answering that, Lucy. We'll come now to Alistair Oak. Alistair, hi, good afternoon. Is he there? Are you there, Alistair?
Sorry about that, Ian. I was just taking your phone call. Sorry about that. Yes, hello, thank you very much. I guess this one might be for Lucy, but anyone else who might like to opine, really. I mean, personally, from what I've heard today and from the announcement yesterday, I wonder if Northamptonshire not being put in Tier 3 might be some sort of clerical error, frankly. We were put in Tier 2, but all the indications today say that, as you say, we're on the knife edge. My question was, is there a sense that Northamptonshire not being put in Tier 3 yesterday is almost delaying the inevitable, given that the next review will be at the end of the Christmas relaxation period anyhow? Do you think maybe we should have just been put into Tier 3 anyway and just got it over with, rather than the situation we're in now? Because I think it's just the wrong call. I'd like to hear Lucy's thoughts.
Thank you very much, Alistair. I think I will come to Lucy, but I'll also come to Tom and Martin to answer part of that as well, because Lucy can talk to the science and Martin and Tom can talk to the politics, if that makes sense. So I'll come to Lucy first, if I may, and then we'll go to Tom and then Martin. Lucy.
Thank you, Councillor Morris. It's always a really difficult call. The challenge at the moment is, you know, our case rates are going in the wrong direction, particularly in Northampton. But in other areas, in the more recent data in the last week, because obviously the data that we provide publicly is slightly delayed. You know, in the last week we've seen improvements, and it's based on the most recent data that decision has been made. So yes, it's a challenge. Yes, we're living on a knife edge, particularly in Northampton. But I still genuinely believe that the public are up for the challenge here. We've got 3 areas off the Chief Medical Officer's watch list before. I think everybody knows in their gut that the right thing to do is to have a small Christmas and not be mixing. And if people follow their heart and, you know, their kind of gut instinct on this, we could come out of Christmas and still find ourselves in Tier 2. Clearly, if people make a decision to the contrary, we will find ourselves probably headed into Tier 3. Now, whether that will be Northampton or indeed wider areas just depends on people's behaviour. And as I said, people have done the right thing before, and I believe that they can do the right thing again.
Thank you, Lucy. It is really in our hands, all of us, isn't it? There's no point blaming people for tiers. It's down to us as individuals and as citizens. I'm going to come to Tom Beattie now. Tom.
Yeah, thank you, Ian. I think it was clear that Northamptonshire could have went either way with the recent tier announcements. I mean, I myself was pleased that we managed to stay in Tier 2, and I don't think there's any inevitability that we will necessarily move into Tier 3 when this is next reviewed. I think I would reiterate what Lucy has just said. It's about behaviour. It's about people complying with the regulations that exist, with the guidance, and doing that in a way which ensures that we keep ourselves and each other safe. If we do that, we can continue to remain in a lower tier. But again, the moving between the tiers, I think, is something, I think, which is sort of based upon information as we get it. And I think the information that was that we had this week showed that in certain areas of Northamptonshire that things were better than they had been, and certainly better than other areas. So I think the decision was made because of that. But I just reiterate the point I've made previously, and that's we'll only stay in the lower tiers if we all do what's expected of us, and that is, abide by the social distancing rules, the hands, face, space, all of that sort of stuff, and avoid unnecessary mixing over the Christmas period. I think, despite the fact that there is some relaxation, that doesn't mean to say that, people are probably tired of hearing this comment now, but, just because you can do something doesn't mean to say you should do it, and think about what you're doing, because we don't want to move up a tier. We want to be moving in a different direction, in the opposite direction. And so therefore, I believe it's inevitable. I think we have the ability to influence that within our own hands if we do things properly. Thank you.
Thank you very much, Tom. And I think we'd all agree with that. Councillor Martin Griffiths.
Yeah, thank you, Ian. And not much to add to what Lucy and Tom have said, except to reiterate that point that we have been successful in the past in controlling this locally, and that is down to the hard work of our professionals, many of them who are here or represented here today, but also the efforts of the public, the majority of the public who have done the right thing. I think it was a bit of a relief for business as well. But those businesses need to remain compliant and vigilant, and that's something that can get us through into the new year, hopefully still in tier 2.
Thank you very much, Martin, and thank you for the question there, Alistair. A very good one. I'm going to come now to Carly Adele. Carly, are you there? Good afternoon.
Hi, good afternoon. One for Lucy, really. Obviously, this week the Prime Minister held a press conference, just trying to tighten, guidance and rules around Christmas. But like he said, the laws are staying the same. So I wondered whether you could kind of shed any light on that, and how people locally can decipher what they're supposed to be doing, what they can and you can't do, when obviously the law's saying one thing and there's guidance for the other.
Thank you, Carly. Lucy.
Yeah, so I think I said a couple of weeks ago when the Prime Minister made the announcement that it was a brave thing to do so far in advance, and I truly believe if you look at the data you can see that we headed in the wrong direction, and if we as a collective don't take action, then we will find ourselves, as we've talked about today, in tougher restrictions. I think the government obviously has got a very difficult job of balancing the economy and keeping people's mental health as buoyant as possible, and I think there's a recognition that is to do with people being allowed to mix, see each other and do things that they would normally do. But I come back to what we talked about this morning. I think people know in their heart of hearts what is right. We know this is a virus that is passed simply from one person to another by contact. And therefore, every time you meet somebody else, particularly indoors, you put them at risk. And the last thing anybody wants to give their loved ones for Christmas is a virus that could potentially kill them. So apply common sense, think about how you want to be protected and how you want to protect your loved ones. And I would suggest that, despite the fact that we can, we really do need to be thinking about whether we should. So my guidance and my local advice, I'm sure with everybody on this call, would be not to be mixing over Christmas and to protect the ones that we care about, and hopefully protect, the idea of being able to get back to normality sooner rather than later in 2021.
Thank you, Lucy, and thank you for that question, Carly. It is, as you say, it's a personal responsibility, and I think that's where the Prime Minister was going with this. Rather than mandating everything, it was, it's down to the individual to decide, as Lucy says, and as you've heard, we've all made our own decisions based on that view. So I'm going to come now to Kevin Nichols. Kevin, hi.
Hi Ian, thanks for coming to me. If it's okay with you, the question I submitted was about viruses, which I think Joe Watt has already covered admirably. I did give the comms team the urgent comms team a notice of a follow-up for Lucy, if I may ask that one, regarding the decision not to put us into tier 2. There was a government report published yesterday, which basically the only box we didn't tick to go into tier 3 was the case numbers of over 60s, I believe. There is a lovely heat map, very colourful heat map on the government dashboard at the moment. It gives the case rates in different age groups, which seems to suggest that those numbers are on the way up. I just wonder if there's any way Lucy can clarify for us which one is, why there's that discrepancy.
Thank you, Lucy. Thank you, Kevin.
So I'm not party to obviously the full decision-making narrative, but certainly from a point of view of the most recent data, as I said, we've got very fluctuating rates in our over 60s, and that is a challenge. We have overall still got an increase in most of our boroughs and districts, but it doesn't quite hit the threshold for tier 3. And our other challenge is of our geography. We have still got a marked difference between what's happening in Northampton and happening in the surrounding boroughs and districts. And clearly the geography of that still plays through as well. We had expected, I think, to see more areas split out into smaller geographies when the tiering happened this week, and that again didn't happen. So at the moment, I think the overall county rate is the one that's being more so taken into consideration than you would say, for example, the Northampton specific rate, which absolutely does meet tier 3 criteria. So it's the changeability is my view, but as I said, I'm not party to the discussions around the full decision making. And the fact that I still genuinely, because of the narrative and the strength of response that we've seen previously, I still believe that there is a view that Northamptonshire can turn itself around. It's done it before.
Thank you very much.
Excellent. Thank you very much.
Thank you for that question, Kevin. A very good one. I think, unless there's anyone else that has a question, that probably is it. Did you want to ask another one, Kevin, or are you happy with that?
No, I'm absolutely fine, Ian. Thank you very much for that.
In which case, I'm looking around the room and I don't see any hands up. And Lucy wants to say something, of course, at the end. I was going to give you the chance in a second anyway, Lucy, don't worry. I was just seeing if there were more questions first. So back to Lucy.
It wasn't a question, and I just wanted to say thank you, really. I know that obviously we are breaking up for Christmas and we will regroup in the new year, which we hope will be very different. But everybody that dials into this call from a point of view of answering questions and supporting myself and my team and the overall system, again, thank you, and I hope you have a safe and a Merry Christmas. But to all of our colleagues as well who have supported us and absolutely have played their part in what has been a successful period of management of COVID, for all the reasons that we've discussed today. You know, the media has played a significant part in that, and I recognise that you've come in for challenge personally and as organisations with regard to reporting some of the statistics, reporting some of the actions that we've taken. But I genuinely have seen you as supportive partners throughout this, and I just really wanted to say thank you very much. And I hope that that continues into the new year and that we continue to reach out and get the support from the population that we need to keep on battling. So thank you very much. I just wanted to make sure that we really do genuinely appreciate it and that was recognised.
Thank you very much, Lucy, and I think we would all agree with that. It's been a journey, and we've all been on it together, I think, and that's truly true of what's happened here. It's been a very collaborative approach between ourselves and, all across parties, across organisations, across the press, and it's largely worked very well, I think. So I would agree with you on that. So I'm not going to say any more other than to say thank you very much, everyone, for coming. I wish you all a safe and happy Christmas, whatever that may look like, and see you all in the new year when we reconvene on, I think, the 8th of January for our update. And it would be lovely to have some very positive news at that meeting about our numbers. So let's all follow the guidance, follow the rules, stay safe, stay well, and we can beat this virus together. Have a lovely weekend, everyone. Goodbye.
Thank you. Bye-bye.
Bye-bye.